My name is Ever Cedeño. Drug-resistant E. coli bacteremia transmitted by fecal microbiota transplant. Definition: Bacteremia. It is the presence of bacteria in the blood. Blood is normally a sterile medium. Treated for the detection of bacteria is individuality of infection. Escherichia coli. These are common bacteria in the intestines of humans and other warm-blooded animals. Fecal microbiota transplant involves the introduction of properly processed stool solution from a healthy donor into the gastrointestinal tract of another individual.
Treating Clostridium difficile with fecal microbial transplantation. A healthy digestive system is home to thousands of bacteria. The intestinal tract includes the stomach, small intestine, and large intestine, which is also known as the colon. In most cases, these microbes are harmless or even beneficial to a healthy individual. However, conditions that require treatment with antibiotics can kill off many of the good bacteria in the colon, allowing the bad bacteria, called Clostridium difficile, to take over. Toxins released by Clostridium difficile can damage the lining of the colon, a condition known as Clostridium difficile colitis. Clostridium difficile infection can lead to life-threatening complications, such as toxic megacolon, where the colon becomes dangerously enlarged. Clostridium difficile is normally treated with a course of antibiotics, but recurrent infection occurs in between 20% to 60% of patients after an initial episode. The standard treatment for a recurrent infection is antibiotics, but in cases where this fails, there is a new alternative treatment. An emerging solution for patients with recurrent infection is fecal microbial transplantation, or FMT. Also known as stool transplantation, FMT restores good bacteria in the colon by using the good bacteria from a donor. Stool samples are obtained from healthy donors and are screened to ensure there are no infectious diseases. There are different ways to introduce the good bacteria, but one common way is with a colonoscopy. First, the stool is prepared by blending it with normal saline, which is a saltwater solution. Using a colonoscope, this mixture can be applied to the entire length of the colon. Studies have shown that over 90% of patients treated with fecal microbial transplantation are cured with no significant side effects reported to date. Please speak to your doctor about fecal microbial transplantation if you are considering this treatment.
Application in medicine. Fecal microbiota transplant uses. I helps replace some bad bacteria in the colon with other good bacteria. The process helps store good bacteria that have been killed or reduced with the use of antibiotics. Resforing. This balance in the colon makes it easier to fight infection. Pros and cons. Pros. The large intestine has many bacteria. They are very important for your health and growth in a balanced way. Cons. It can cause bacteremia and subsequent death of the patient if the patient has a low immune system.
E. coli is a type of bacteria. It lives in your intestines and it lives in the intestines of animals. Most of the time, E. coli is harmless. You're not going to get sick. But there are some strains that can get you sick. E. coli 0157H7 is a particularly dangerous strain of E. coli. You can get it from undercooked ground meat, you can get it from vegetables, from unpasteurized milk and juice, from soft cheeses. While it is found in vegetables, ultimately an animal is the source, so animal waste somehow has come in contact with crops. Children and adults with weakened immune system, they're the most vulnerable to getting very sick. The signs of E. coli poisoning are nausea and vomiting, abdominal pain, cramps, fatigue, and fever. And if someone gets bloody diarrhea, that's a huge red flag that the infection has become severe. Most people who get sick from E. coli, they recover in 5 to 10 days. But some people, they get really sick. Their organs can shut down and they can die. There are things that you can do to prevent an E. coli infection. Wash your fruits and vegetables, cook your meats thoroughly, use a thermometer and get that thermometer up to 160 degrees. There's no cure for an E. coli infection. Antibiotics don't work, so the best that you can do is keep yourself hydrated and keep yourself rested.
Issue apply in Ecuador. Drive-in cure. The United States Food and Drug Administration (FDA) has issued a survey alert about the potential risks of serious infection caused by organisms resistant to multiple drugs related to the investigation. Use of the Fecal Microbiota for Transplant. Information taken from the Ecuadorian blog Medical edition. Conclusion. In conclusion of the article is that the fecal transplant has got good and bad things. It corrects the risk of causing bacteremia and even death in patients with low immune system. Therefore, it will cause adverse effects. One of the patients in the study developed bacteremia due to gram-negative as a result of the therapy and the death.
Roper St. Francis Healthcare's House Calls TV.
One of the risks of taking antibiotics is it can kill the good bacteria that live in your colon. This can lead to a painful infection called C. diff colitis. Dr. Anthony Farilis highlights a therapy that can deliver almost immediate relief to people who are suffering with this colon infection.
We see patients that have been on rounds and rounds and rounds of expensive antibiotics for months, and they're not getting better. Then you are a potential candidate for fecal microbial transplantation.
This is an outpatient procedure performed much like a colonoscopy. Once the patient is sedated, the doctor can transfer good bacteria into the colon.
And then we take well-tested, healthy fecal bacteria and we implant it onto the lining of your colon. The response is within 24 hours. They grow and populate the lining of your colon, and then it basically outcompetes the C. diff that's causing all the problems, and you get better.
For more information, call 402-CARE, and for more House Calls TV, visit us online at rsfh.com.
Roper St. Francis Healthcare's House Calls TV.